البلمونري ريهاب اللي هو مفقود والإديوكيشن والسبورت اللي هو زي ما اتكلمنا من بكري أن لازم كل طبيب ياخذ دوره في هذا الموضوع، مش موضوع تشخيص ووصف وبسرعه يعني نقعد مع المريض 3 دقائق ونعطيه وصفه ونفرح باننا وصلت للدايجنوزس. الموضوع يحتاج اني انا نقعمز ونهدرس معاه ونعطيه البروجنوز، لان هذيك التقعميزه اللي مع المريض راهي نادره جدا وبريشيس ومرات ما تتكررش. فهذه الحاجات اللي هي في البيشنت باتوين اللي لازم تكون موجوده. احنا نبدو من الاساس بعدين نطالبوا يعني ان المشكله بتاعنا تكون كومبليتد. نلاحظوا ان اكثر جريد يجينا بها مرضى اللي هو جريد 3، لكن ايضا في عدد لا باس به من البيشنت عند جريد 4 وجريد 5. البوست كوفيد كانت ميكسد، يعني في منهم راديولوجي، في منهم بوست كوفيد يجونا ان اس اي بي، في منهم يجينا يو اي بي، ما هيش قاعده، لكن احنا بعون الله يعني العياده مستمره وحيكون في تفاصيل اكثر ان شاء الله في المؤتمر القادم. وايضا الدكتور حسن والدكاتره الدكتور انس والمجموعه حيسلطوا الضوء اكثر عليه تفاصيل ان شاء الله في البانل ديسكشن في المحاضره الجايه.
The idea for the conference originated from the medical team at Abu Sitta Hospital in the Libyan Thoracic Society, with the aim of shedding light on a deadly disease that receives little attention. The condition is marked by limited availability of treatment and complicated diagnostic procedures. The event was organized to address the issue comprehensively, covering accurate diagnosis, ensuring the availability and continuity of medications, post-treatment care, managing advanced cases, providing oxygen to patients, as well as awareness, education and prevention. A key part of the conference was giving patients a voice. Interviews were conducted with several patients who urged officials to provide diagnostic equipment and to establish a clear and structured pathway for treatment, from the onset of illness to recovery. The meeting with officials proved to be highly constructive, with speakers emphasizing the crucial role of doctors in advancing the health sector. Reform, they stressed, must begin at the grassroots level with physicians themselves. Responsibility should not rest on officials alone. Doctors also bear accountability, particularly for failing to join scientific and advisory associations that are responsible for setting treatment protocols and guiding both patients and the healthcare system. The financial burden of the disease was another major point of discussion. While medications are costly, delayed treatment often leads to worsening conditions that require intensive care or long-term hospitalization, creating even greater expenses for families and society. Patients who reach advanced stages of fibrosis and become oxygen dependent, losing mobility, ultimately become persons with special needs, which increases the cost for the state. Early intervention through timely diagnosis and ensuring a steady supply of medication was highlighted as a positive step that reduces the burden and paves the way toward stability and safety.
When we talk about pulmonary fibrosis, we have to know that the anatomy of the reticular lung disease is all about interstitial. And here, the specific case of the scleroderma, we can see that there is a lung fibrosis with structural bronchiectasis and unincumbent, but we see in the middle there is esophageal dilatation on this goes more with the diagnosis of scleroderma. Here, another patient with massive honeycombing, okay, and structural bronchiectasis. That there is more crown glass opacity with structural bronchiectasis, but there is this honeycombing, and we suspect this goes more with non-specific interstitial pneumonia.
Pulmonary fibrosis was one of the main themes, with the Pulmonary Fibrosis Clinic at Abu Sitta Hospital launched in 2022 after a significant number of patients were diagnosed and faced shortages of the vital medication. it became necessary to raise public awareness and inform state officials about the seriousness of the disease and the importance of its treatment. Around 25 patients were diagnosed at Abu Sitta Hospital with the medication provided through a donation from the German company Mahary, which had a major impact on those receiving treatment. This experience inspired the idea of making the conference a platform that connects officials, doctors, and patients. Videos of patients were also presented, including those dependent on oxygen and others who purchased their treatment from outside Libya. The efforts allowed some patients to access medication for 2 to 3 months. Organizers stressed the importance of highlighting this disease and its impact on Libyan society.